I think that people think that nursing is working on wards, whereas in substance use, there's so much more to it, and it's a different way of nursing, and I've really enjoyed it. Before I worked in substance use, I'd worked in retail and I'd done my psychology degree, and I'd had some care experience in a care home. So, I am quite a compassionate and empathetic person. I think if you have those qualities, you've got what's needed to work in substance use. I think a lot of it you kind of learn along the way. You're not expected to know everything, but the organisation is so good in supporting you in learning those things. As long as you're a people's person, you can communicate, you have emotional and social intelligence, then absolutely apply for a job in substance use. There's lots of different avenues in substance use services that you can go down. So mine is quite unique and niche in that I decided to go down the clinical side, but you have the operational side. We now have the mental health team, the psychology side of things, and there is no normal average working day in substance use. So we kind of support clients with their health and well-being where they are in their recovery journey. So that could be looking at their mental health, physical health, social circumstances. And although we might not be able to do a lot to support them, we can help with that signposting or referrals, and potentially we might be the first people that the client has actually disclosed an issue to. There's a lot of stigma around substance use, so often we do get those disclosures in our sessions, which is nice. And I guess whatever that disclosure is can take you on a different journey throughout that day. You could spend hours looking for an appropriate service or professional to help somebody. It could be getting somebody emergency treatment if that's what they needed. So no day, I would say, is ever the same. My favourite part of the job is meeting lots of different people with lots of different circumstances in life and meeting people where they're at. I think that as an organisation, we're really good with that patient-centred approach. We don't expect somebody to stop using drugs or alcohol. We know that that's not easy. And it's about meeting people where they are at in terms of their own goals and that being okay. And I think I really like that we don't just have a one-size-fits-all approach. We can adjust the way we work for different people, depending on who they are and where they are. It can be challenging at times, but I would say that those challenges are often quite rewarded in the end. The Lincolnshire Recovery Partnership have been a great support through my prescribing course. I'm really proud of myself that I've achieved becoming a nurse prescriber, because when I was a key worker, that's all I ever wanted to do. So looking back on my journey over the past 5-6 years, all of the hard work and the support from the team shows that it's been worth it.